If you don't use your vagina, is it gonna shrivel up to nothing and go away? Hi, I'm your local OBGYN. I love women, and let's talk about this. The old saying, if you don't use it, you lose it. Let's talk about why this has a little bit of truth and a little bit of mistruth in it. So the vagina is so hormonally responsive to estrogen that when it goes away, we've talked about the thinning and how it gets more sensitive and how it loses its stretch and its moisture. So if you are not having penetrative intercourse down there, then what can happen is as that atrophy continues, it can go down in size somewhat so that when you try to have P and V intercourse, it can be uncomfortable and feel like things don't fit. Okay, this does not mean that this will happen to most people. If somebody is having some sort of penetration with some regularity, the likelihood is much less. It doesn't mean that it's comfortable. However, the topical estrogens will make a very big difference in these areas. And even if you did have a decrease in size of the vaginal length or its width, you can usually get that back with topical estrogen and sometimes even getting vaginal dilators, which are easily found on places like Amazon, to help retrain that tissue to allow penetration down below. Had no idea that your itching could be more than just yeast? Comment below and tell me what you are experiencing. Did you know that your vagina is full of bacteria and it's okay? Hi, I'm your local OBGYN. I love women, and let's talk about it. Our vagina has all these types of good bacteria, but it also has yeast and BV and all the things that can cause us a problem. So how is it that we can live like this? It's because we live in what is a good balance for our system, where the good stuff generally outnumbers the bad stuff, which then keeps us asymptomatic, happy, balanced, and moving forward in our day-to-day. Now, what do we need to know? We know that there are certain stressors that can come from the outside or the inside that can shift that balance, and then we end up with BV, yeast, irritation, all the different symptoms that can come from vaginitis. So things that can shift that are diet, stress, illnesses, antibiotics, douching too regularly. Some people have irritation to certain products like condoms or underwear. So you need to be aware that you do have some control over these things. There are other things that are tricky, like if you run high sugars and are diabetic, you could be more at risk of skewing the balance and creating environments where these other bad bacteria like to grow. So my favorite things to do are, number one, you should wear cotton underwear, or especially at night, maybe no underwear. You don't need to clean inside the vagina. It's a self-cleaning oven. All right. You should stay away from perfumed or heavily scented soaps and things like that, and avoid the thongs, please. What can cause chronic boils and abscesses in the folds of our skin, including our girl parts, that can erupt with gross-looking pus like discharge, and is not because it's a hygiene issue? Hi, I'm your local OBGYN. I love women, and let's talk about it. Hidradenitis suppurativa, HS, is not an uncommon scenario where we see these chronic little tunneling-like infectious boils that kind of like tunnel in our skin. They can erupt and drain, and they can leave some pretty significant scarring in our groin, armpits, under our tummy, under the breasts, in any of those skin fold-like areas. And for a long time, there was a big presumption that this was a hygiene issue, which it's really not. Okay, we tend to see this more commonly in heavier women, smokers, and people with a genetic predisposition for it based on maybe a family history. But that being said, it just happens to some people. And there's all these like long course treatments that can be considered. One of them is special type solutions to bathe in, chronic antibiotic uses. And then some people need to go on something a little bit stronger because we think that there might be an autoimmune component to it that will reduce the risk of the scarring, because it can be so disfiguring and so upsetting that some people will have literally no physical contact with other people for fear of them seeing these areas. Feel lost in your female health journey? Follow along here and we can get to the bottom of it together. Cottage cheese discharge that makes you want to scratch your girl parts off. Hi, I am your local OBGYN. I love women, and let's talk about this. So many women, meaning 75% of women, will at least get one yeast infection in your lifetime. We often see symptoms that are itching, white, thick cottage cheese, yes, I said that, like discharge, that's really irritating both to the inside of the vagina as well as the skin and tissue on the outside. Common causes are recent diet changes, antibiotics, using very aggressive cleaning things down there, hormonal changes, and otherwise just disrupting the general balance. So what can you do to reduce your risk? Number one, gentle stuff down there. Number two, if you get an antibiotic and you're prone to these, you may want to ask for a prophylactic dose of something in case that happens, all right? Number three, air it out. No undies at night. Let the area air dry. But treatment, there's lots of over-the-counter options, but I have some tricks that I think need to be considered. All right, over-the-counter, you can get the topical inserts that can be really helpful. I am not a fan of the 1 and 3 day options. I find that they are kind of like too potent and irritating for tissue down there, and I have more people coming in with side effects from it than actual successful treatment. Otherwise, I think that the 7-day course is the way to go for inserts down there, or getting the oral treatment with those 1-day pills can be really beneficial. If it's chronically occurring, you may want to get things like your sugars checked, which can certainly promote recurrent yeast infections. The chronic itch scratch cycle in your girl parts that makes you want to pull your hair out. Hi, I'm your local OBGYN. I love women. And there is a very common skin condition that we are not prepared and educated for enough called lichen sclerosis. This is a condition that is an inflammatory scenario of our external and sometimes internal female parts. So what happens is when we have good estrogen, we have good elasticity, hydration, and what we call barrier protection, which basically means that there's sort of like a generalized shield on top of that tissue to reduce the chance that things are going to be irritating to the skin. And when that estrogen goes down, the inflammation of that area goes up. And this is where we start to see commonly something called lichen sclerosis. So what I can identify as a gynecologist is that a woman comes in and she says that she has had this chronic itch, no discharge. She's had swabs that show no infection, and she's really frustrated because like, what is going on? And she is just not getting relief. So when I take a look at the skin itself, it does look thin, fragile, and very pale in appearance. Some women's skin can actually almost look like white, like super duper pale in that capacity. So one of the best things you can do is add estrogen back in topically to this area, because it will rebuild some of that tissue back to the way that it once was. But oftentimes we need to do intermittent high potency steroid down there because this is a chronic condition. You know, the balance of the estrogen isn't going to magically revert to our premenopausal days. It can certainly get better if we do topical estrogens and sometimes systemic estrogen, but it's a chronic scenario that may need maintenance for the rest of your days.